are on location today with Skin Sense and Dr. Steve Schleicher. We are talking about skin safety here at the beautiful Eagle Rock Resort. We decided to take our show on the road.
Absolutely. Oh, I am Dr. Schleicher, by the way, in case nobody recognizes me. I rarely wear this in the office.
Yeah, you know, we say to protect your skin from the sun, and Goofy over here brings out his goofy hat and his rather large sunglasses. And people tell me my sunglasses are large. I think you got me beat.
The problem is people think I look better this way.
There you go.
So that's
You're
a major
protecting
problem.
yourself from the sun and from other people.
Exactly.
I love
exactly.
it.
Yes.
I love it.
Yes.
So we have a guest with us, and we have another guest coming on later, but we have Matt, and he's going to school to be a physician's assistant, correct?
That's right, yep. So I'm in my second year, my clinical year of my physician assistant studies, and I'm currently just about to finish up my dermatology rotation with Dr. Schleicher.
All right, how's that going?
Oh, it's going great. It's been a terrific experience.
Pretty rough on him, but he's doing real well.
He looks like he's ready to cry.
Not yet.
But you like derm.
I do,
right?
I do. I've enjoyed it.
Yeah, maybe you could tell us a little bit about, what you've seen.
Absolutely, there's been a lot of interesting cases. We've seen like T-cell lymphomas, a lot of different skin cancers, and your average acne and everything else like that. But it's been interesting.
And of course today's show is about sun and skin cancer, so it's a perfect tie-in. And of course that's why I'm wearing what I'm wearing, because we like to emphasize skin protection, especially for those who need it. So who needs it? Well, obviously people who are fair skinned need it the most. People who have a history or family history of skin cancer, it's an absolute necessity to be very, very careful in the sun.
When you live in an area like northeastern Pennsylvania, we have these harsh winters where we're hardly getting any sunlight, and then you have these beautiful 12 weeks of spring and summer where we are doused with the sun, and with people wanting to spend as much time as possible outside soaking it up. So again, this show is to inform people about, we want you to have fun in the sun, but we also want you to protect your skin, because you really can develop, as we'll see later with our guest, you can develop skin cancer and not even really realize that you have it. So first, what should people do to protect themselves from the sun?
Well, again, if you're really fair-skinned, you want to avoid the sun. Okay. If you have a history of skin cancer, you have to be very, very, very careful. Everyone wants to avoid indoor tanning. Okay, that is definitely a no-no, and that is really bad for you. Okay, if you don't believe me, just do a search on Google and put in indoor tanning melanoma, and that is one of the leading causes of melanomas in young people.
If we know that tanning booths definitely cause skin cancer, how can we continue to have people out there using tanning booths over and over and over again? It really blows my mind on how this is still happening.
But guess what? We know that cigarette smoking causes cancer. And we have 25% of the population who still smokes. Okay. The interesting thing is more and more states are regulating indoor tanning. Okay, so over half the states now either forbid minors or will not let anyone under 17 in. So that's a good sign. Okay, so finally we're making good progress, actually, much better progress than cigarettes, where you can walk into any store and buy a pack.
Right. Matt, you're a young guy. What do you think when you see, maybe people think, oh, when these younger kids are thinking, I'm not going to get skin cancer, what have you seen with going through some of the rotations that you've been in?
And everyone is at risk. We've had patients that were in their 20s that came in with skin cancer, so it's definitely good to protect yourself, avoid the tanning beds, and sunscreen. Sunscreen it's needed.
When you talk about protecting your skin, Doc, and you say if you're fair skinned, you should absolutely not go in the sun. To me, that sounds almost like impossible to do.
Yeah, it's draconian. But some people do, because they're so afraid. And if you've had something that's kind of bad, you don't want another something that's kind of bad. But you're right. I mean, for most people, it's impractical. So what do? Well, you wear like long sleeve shirts when you're out. You wear a hat like I'm wearing, okay? Obviously not this goofy, but you want to wear a cap or a hat, because that's very important, because you can get reflective rays, off the surface. So, and then of course you want to wear a sunscreen, okay? And this day and age, all sunscreens are numbered. We all know that. The higher the number, the better, okay? And what what consumers have to look for, it's expensive. I mean, you have a whole family and you're buying sunscreens for the whole family. So the good news is Walmart's, the Targets, they have their own brands, they're inexpensive, and they work.
Okay, when we talk about children and the safety for the sun, it is the, you know, adults, you know, that is one of their responsibilities to make sure that babies, you know, I see these babies in the pool and they're splashing around, they're happy, and then you know, sometimes you see a child with a bad sunburn. How damaging could that be for their skin later on in life?
That's a very good point, because it's clearly been shown that burning, blistering sunburns are related to melanomas later on. So it's very tragic when we see youngsters who are just put out in the sun and left there, okay, because that increases their risk of getting melanoma by many, many fold.
So when you have children, again, I try to, how effective is it when, like, I'll have my kids spray their tanning lotion on before we leave the house? This way, at least I know they have some coverage leaving the house. But how effective is spray suntan lotion versus creams?
That's a great point. Actually, Consumer Reports just a month or so actually reviewed some of the sprays and found them to be really as effective as the non-sprays. The glasses are falling off, but God forbid. But the key thing to remember too is that the pediatricians and some dermatologists don't like kids to use sprays because we're worried about them inhaling the spray. So it's probably better off, if you're going to use a spray on a kid, spray it on your hand first and then rub it on the kid, rather than, certainly not on the face at all, for anybody.
Yeah, so spray it on your hands, put it on your child, and then keep reapplying, or have them wear a t-shirt. And it's very important. I know I have kids myself, and it is very, you know, aggravating that they'll fight you on coming out of the water to reapply suntan lotion, and you really have to stay with it and say, this is important for your skin. And you've seen the horrors of, you know, not to scare people, but sometimes showing pictures and having guests on really hit home and could save you from developing skin cancer. So this show, again, if you're just tuning in, we're here at Eagle Rock Resort. We're with Dr. Steve Schleicher, and our guest is Matt. He is going to be a physician assistant. He's doing his rotation with Dr. Schleicher in dermatology. And when we come back on the show, we are going to have a guest on with us that actually developed skin cancer. I cannot wait for you to hear her story. She was young when she got it, and the story could be life-saving for you. Matt, thanks for thanks for coming down here to Eagle Rock.
Absolutely, thank you.
And I wish you luck. I'm glad he didn't make you wear the goofy hat and sunglasses.
No, he didn't.
He's going out now to get his tan.
All right, well, thanks for joining us. And like I said, when we come back, we'll have Aleida Keegan with us here. You're watching Skin Sense. We're on location at Eagle Rock Resort. We are at the beautiful Eagle Rock Resort, and we are talking about skin safety with Dr. Schleicher. If you're just joining us, we talked about the ways that you could protect your skin, and we had a physician's assistant student on, Matt, who was with Dr. Schleicher in rotation. Now we have Aleida Keegan. And Aleida, thank you so much for being on the show.
Thank you for having me.
So Dr. Schleicher and I were talking, and we wanted to really bring home the message of sun safety, and you actually developed skin cancer. So we wanted you to share your story with all of our viewers. So thanks for being on again.
Thank you again for having me. Well, my story began about 17 years ago. I was a huge sun worshiper when I was young. When I went away to college, I was laying out on my black tar roof at college, tanning out there. I had the baby oil on. It was, you know, never sunscreen, always the baby oil, you know, always out tanning. I'd go to the tanning beds all the month of June so I could get that base tan before I got my real tan, and, you know, just all about the sun. And I remember my mother as a child would say, you know, I'd go in and I'd say, you know, do I look tanner? Do I look, you know, darker? Am I getting dark? And she'd say, Aleida, it's not a healthy glow. It's a symptom of a disease. And when she said that to me, jokingly, I said to her, when I die, put me in my casket in a bikini and let everybody admire my beautiful tan. Years later, I was 32 years old, I was diagnosed with malignant melanoma, and that thought became a reality. I had 4 young children. My baby was 2, my oldest was 9, and my stepdaughter was 14. And I had been sitting down the swimming pool next to a girlfriend. I was, you know, in my bathing suit. The children were all playing in the pool. They were all lathered up with sunscreen. They had their shirts on, their hats on. Everybody was covered but me. And I'm sitting next to a girlfriend of mine, and I said, boy, there's this mark on my leg. I said, it was never there before. I'm noticing it when I'm shaving, you know. What do you think, you know? She said, oh, don't worry about it. It doesn't look like anything, you know. So I didn't really put a lot of thought into it. I knew it wasn't there. It wasn't normal. I hadn't always had it. But at the same time, I had been losing my hair. The baby was 2 years old. I had nursed him for a whole year. So my hair was thinning, and I was losing clumps of hair and everything. And I thought, you know what? I'm going to call the dermatologist, and I'm going to go in and see her about my hair loss. And as an afterthought, I said, I'll have her check out this mark on my leg. So I went in and I saw Dr. Veglia, and she went over my hair loss with me. And then I said to her, oh, and these marks, I have a couple marks I want you to look at. So when she saw the one on my thigh, she took a look at it and she said, I don't really think it's anything. She said, but I'm going to take it off. And she said, I'll do it right here in the office right now, no big deal. She said, I'll send it out and we'll get back to you with the results. And 2 weeks later, I got the phone call. And she said, I don't even know how to tell you this. She said, but you have malignant melanoma. And even at that point, I thought, well, okay, it's skin cancer, so it's topical. You take it off, and I'm good. Well, then I started researching, and I spoke to my husband, who's a pharmacist, and sat down with him. And when I realized what malignant melanoma was, I couldn't believe it. I was so naive. All those times in the tanning beds, all those times out in the sun, had no idea how serious this cancer was. I had cancer removed. I went to a doctor. Actually, my plastic surgeon was out of town. I had called him and I wanted a plastic surgeon to do it. It was on my leg. I was a little vain. I didn't want scars. So I called my dermatologist back and I said, I have an appointment with Dr. Lung in 2 weeks. She said, you can't wait 2 weeks. And I thought, oh my Lord, like why? This is skin cancer. This isn't breast cancer. This isn't, you know, I thought it was different. Even though the word cancer was in it, I thought it was different. And she said, we want this done immediately. And I went back to her office that day. She gave me prescriptions for blood work and chest x-rays and all kinds of prescriptions, all kinds of tests. I got done immediately. And a week later, it was the day before Thanksgiving, I had it removed. And thank God, I had no chemo, no radiation. It was stage 1. I had caught it early. But it was a rude awakening. I was a sun worshiper, and I just had no idea the damage I was doing.
Well, you raised some good points. Number one, not only were you out in the sun, but you did indoor tanning.
I did.
Which we said is very, very bad. The other thing, your melanoma was high up on your leg.
Yes.
Okay, which is amazing because most skin cancers we see where you get sun exposure. But melanoma is a little bit different, okay? There are hereditary factors. It's not directly related to direct sun exposure. But as we said before, it's related to sunburn, mainly as a kid. That's one of the factors, okay? And we see melanomas anywhere. You can see melanomas under the fingernail, okay? Areas where you would not even expect a skin cancer to be, they can be there.
Now Aleida's stories is something that you see and hear in your office a lot?
Yeah, we see it because we're seeing younger and younger patients developing skin cancers because they're so into indoor tanning.
At the time, doctor, that I was diagnosed, I was the youngest patient she had ever seen with malignant melanoma. Since then, in the 17 years since then, she's had patients, like doctor said, in their teens, like a 19-year-old, people in their 20s. I had 2 friends that passed away at 39 years old. Healthy people. They would run 5 miles a day, you know, eat healthy and everything, but didn't take that sun precaution
so that's
seriously.
Another good point, because if you have a mole that just doesn't look right, we actually call it the ugly duckling sign. It's a mole that just doesn't look like your other moles. So that's the ugly duckling. So if you have one of those, that can be a sign of melanoma. And that's a pretty good tip-off that something's wrong, because it's not like your regular run-of-the-mill mole. And yours was something like you didn't even suspect it. 'cause
No,
it didn't
was.
look like
No, it
anything.
didn't.
But
It
your
was
mole
pink.
was something that it came. You didn't have it all the time.
No, it wasn't something that changed or developed, you know, like progressed or anything. It was new. It was a new mole, and it wasn't that black, thick, crusty thing. It, you know, it wasn't scaly looking. It was pink. It wasn't even ugly. It was
looked
pink,
like
but
a eraser from a
it
pencil.
did. It was that size and that color, and it was just a raised mark that I never had before.
Which again brings up a very good point that melanomas can arise from existing moles.
Okay.
So if you have a mole you've had forever, and all of a sudden you look and say, wait a minute, that's changed, that's a bad sign. But melanomas can also arise just for the sense of arising, like yours did. And all of a sudden you look and there's something new, and you said, wait a minute, that wasn't really there before. That's when you get it checked out. So
What are
you
the
were lucky,
signs,
actually.
Again, for people that don't know what to look for in the
Right.
ABCD,
So if
what are we to F
right.
now?
So
There's
it's
different-
really the ABCDEs of
Yeah.
melanoma, okay? And basically you're looking for moles that just aren't symmetrical,
Mm-hmm.
moles that have irregular borders, moles that have certain colors, like red, whites, and blues, not good colors to have in a mole. You mentioned a pencil eraser. Any mole that's smaller than a pencil eraser, chances are it's not a bad mole. If it starts getting bigger, yeah, and E stands for evolving or changing. So yeah, if you have a mole that's getting bigger or changing, yeah, you want to get that checked out, absolutely.
Okay, so after you had your mole removed and you knew that you didn't have to go through the radiation and chemo, how did your life change after that?
Well, for 2 years, every 3 months, I had to go for more blood work. I had to go for chest x-rays, mammograms. I had all kinds of stuff that I needed to do every 3 months for the first 2 years. And they did find 7 precancerous marks on me in that first year. So they would have changed. They could have changed. They probably would have changed. And then after the 2 years, I started going every 6 months. And then after 5 years, I go every year. Unless, like doctor said, I see something changing or something new comes out, then doctor wants to see me immediately. But I recommend anybody go once a year and just let the doctor do a base scan, a base checkup, everything. Then he'll know if something changed when you go back the following year. Maybe something you don't see. I was walking up the stairs and my husband said to me, there's a mark on the back of your leg. The back of my leg. Sure enough, I went in, it was a precancer. I never saw it, I couldn't see back there, but I'm all about the hats and the sunscreens and the covering up and the sunglasses, because like doctor said, it could get in your eyes, it could be under your nails, between your toes. So I'm very, very, very cautious now. I love the sun, that will never change, but how I deal with it and how I spend my time in it changed dramatically.
So Doc, if you develop malignant melanoma, what are your chances of it reoccurring, or is it different in each
Well,
person?
the good news is if you catch it early, it's 100% curable. And obviously you're cured. I mean, it's been over a decade, so you're cured. I mean, there are rare cases where, you know, it can't come back, but it's very, very unusual, okay? But people can develop. Once you get one, you're more prone to getting others. And of course, there's family histories involved, so obviously your kids have to be careful and your kids have to be taught what to look for. That's very, very important because it can run in families, and some families are much more prone to getting melanoma than other families.
And I never had family history of it. No one in my family ever had it. My grandmother was diagnosed with basal cell carcinoma at 85 years old or something, so it was never a family history, but Doc's right. I mean, it's a precursor.
Well, you get a mutation, it's called a mutation, and the first person who gets it then can pass on that mutation to their other, to their family, okay, mainly
Something
kids.
we don't want to be passing
So
on.
yeah,
No, that's one thing I don't want them to
Right,
inherit,
right.
correct?
So
Yeah.
that's why people who have a family history of melanoma, you have to be real, real careful.
All right, you're watching Skin Sense. We're here at Eagle Rock Resort. We're talking about skin safety, especially with the sun. We want to get out there, we want to enjoy ourselves and the outdoors, but we want to do so safely with Aleida Keegan as our guest and Dr. Steve Schleicher as our host. We'll be back right after this. Sun safety, we want to have fun in the sun, but we want to do so in a safe environment. And on Skin Sense, it's a brand new show with Dr. Steve Schleicher. We're here on location at Eagle Rock Resort, and we have a very special guest with us, Aleida Keegan, and I'm really thankful that you came on. I know that you get emotional talking about it, but you really are saving lives by people knowing that it's real, that it's not just preaching. We have to show really what the sun can do if you don't protect yourself from the skin. I know you're helping a lot of people. You've been telling this story for years.
I have, and that's my main goal. You know, I have young daughters, exactly, and their girlfriends were always like, "Yeah, prom's coming up. Let's go in the tanning beds." And my daughters would say to them, "We can't. You know, my mother had melanoma, and it's bad for you." And it's so if one or two young girls will say, "You know what? I'm not going to do that because my friend's mom said it's bad and she got cancer from it. I'm not going to do it." Makes me happy.
I hope my best friend's watching this because she's light-skinned and we're going on vacation, and every time before we go on vacation she says, I have to use a tanning booth, and I'm going to ask you if this is fact or fiction. She said, I have to use a tanning booth because I don't burn in the sun then if I use a tanning booth, so it's actually better for me.
Well, it's absolute fiction.
This is
okay. It's
that is
fiction.
I call BS.
Yeah,
so I tell her.
See, the problem with this tanning boots, okay, it's a different light source, which actually penetrates deeper than just regular so-called UVB light that gives you the sunburn. But it could do just as much damage, and you don't even know it's doing damage.
Okay.
So that's where the problem comes in.
So don't use the tanning booth. I tell her this all the time, and she has freckles and light skin.
Yeah, people don't listen.
You know,
I want her around forever.
Yeah,
it's a quick fix. You know, you go in the tanning bed for 10 minutes or 20 minutes.
And even quicker fix is you get the fake tan and you put it on.
There you go.
Know what I mean?
Now, let's talk about some of the products. Well, first of all, before we talk about the products, do men or women, does the malignant melanoma favor one or the other more?
Yeah, real good point, because nowadays, well, guess who goes to indoor tanning? You don't see too many guys going to indoor tanning.
Well, I know some guys who do, but women, I would assume women, because women are, you know, the tanners.
Yeah,
so most of them more vain.
Yeah,
you
so
want that nice...
most of the media attention now is on, well, it's just a thing on Facebook about that girl who you showed her treatment, right?
I'm glad you brought that up.
So, and she's, what, 23-year-old who developed skin cancer, and she says directly from indoor tanning.
Yes, and she actually showed the treatment and how horrific it was, and that's, you need to almost scare people into, oh my God, this girl's 23 years old, beautiful, beautiful girl, and she has all these marks on her face as she's getting this treatment. I actually reached out to the young lady to see if we can do a phone interview with her.
Well, it took a lot of courage on her
I'm waiting for her to get back
it really
to us.
took a lot of courage.
Her story is really, you know, one of those like Alida's.
And she didn't have melanoma. She had the type that are directly linked to, you know, indoor, well, basically to tanning in general, to sun.
Okay, so it's mostly women, and we know why, because we're more vain.
Well, it's more women now for melanoma because they're doing more indoor tanning.
Right.
And like the percentages of women who do indoor tanning in this country are absolutely unbelievable. Like 80% of college females tan indoors. 80% still, as of last year.
Wow.
It's a staggering number.
We need to get this show national.
Yeah.
Gotta get the word out.
We are. We're gonna. This is online, so we got to get people watching this. There are some products, and I talk about some of them on my own Facebook when I try them, because the thing with these and the color is sometimes they streak, and then it's a whole process. So these are some of the things that you use.
They are. They are.
And this one's nice. I actually, not to promote any certain product, but Jergens has like that natural glow, and it's over time.
It's progressive, exactly.
It's progressive, but it isn't a sunscreen. So you need to, when you're outside, you need to put sun protection over it.
Excellent. And nowadays, a lot of cosmetics say, you know, they have sunscreens in them, like a sunscreen of 15. But guess what? Most people don't apply the proper amount, so you're really not getting a 15. You're really getting like a 2 or a 3. So you get this false sense of security that you can actually spend more time outdoors, but you really can't, because it's really not blocking out the damaging rays like it, you know, you think it is.
Yeah. Now I'm a huge baseball cap fan, so I always have like a hat and sunglasses on. People always say like you're wearing your sunglasses in the winter, but I have like my eyes are blue, and I'm very sensitive to the sun. So I wear my hat. You know, if I could, I'd walk around with a towel on too, but I guess that would look a little odd walking around town with a towel on. But
is that all you're wearing?
Yeah, just the towel. That's it, and the hat, and the hat, and the sunglasses. So we're good luck. We're covered.
Wear that for the next show. All right, that'll be perfect. That'll be the highest rated show that we've had.
So these are some of the things that you really have with you and have instilled in your kids.
Yeah, I carry them all the time. I probably have 20 or 30 things of this all over the house, in all the bathrooms, in the kids' bedrooms, wherever they go. My son was going fishing or something the other day, and I said to him, bug spray and sunscreen. He said, I'm not wearing that. He is 18 years old. I said, you are.
Yeah.
You are wearing it. And like you said, I put mine on before I leave the house, and then I apply it again every couple hours.
Like you do
afterwards.
lotion.
Exactly.
How long can you keep, like if you have sunscreen at home, and moms and dads listen up, if you have sunscreen from the year before and then you dig out that bag, is the sunscreen still good?
Well, it can lose efficacy over time.
So throw it or not?
So, well, I mean, it's kind of variable. It depends
Okay.
on the sunscreen and what chemicals are in it.
Okay.
So you can either look on the label, it'll say when it expires, or you can actually call up the company and say, how long will your sunscreen
When in
last?
doubt, I would say just
But-
get new sunscreen, especially if you're protecting your child.
Yeah, but
you
again,
know?
again, the point is, sunscreen's not cheap. And when you have 4 kids or 6 people in your family, and you're outdoors all the time, it's an expense. Okay,
Yeah.
it really is an expense. You're lucky your husband's a pharmacist, so you get a good rate. But so that helps.
We hope.
That helps.
That's the perks
right.
of being married to.
I hope he doesn't charge you too much, right?
So, Aleida, in closing, we are wrapping up the show. What is the one message that you'd like to get out there, the opportunity to speak to our viewers on sun safety?
Well, like Doctor said, number 1, no indoor tanning beds. Number 2, nobody's going to avoid the sun. We don't get enough of it. So protect yourself, whether it's sunscreen, hats, sunglasses, long sleeves. Sometimes clothing now actually has a sunscreen, protection in it. I use an umbrella at the beach. Sometimes if I'm going to be outdoors long enough, I'll use an umbrella to cover myself at a baseball game or something like that where I know I'm not going to be covered. Stay protected. Stay protected and protect your family.
Very good. Well, I appreciate you coming on the show.
Thank you for
We were
having
able
me.
to have an excuse to come to Eagle Rock and enjoy,
Yes, beautiful
at
Eagle Rock.
least we're not having a picnic
Yeah.
yet, but we're down here in the beautiful beach and the lake and seeing all the fun activities that we can be doing in the sun and enjoying ourselves throughout these summer months. Again, protect yourself also in the winter and fall, as we discussed, and keep yourself safe. So, Doc, thanks for
No,
coming
it was
down.
my pleasure, and you did wonderful. That was
Thank
great.
you.
I mean, hearing
Thank
it firsthand is
Thank you.
a lot better than a doctor telling you what you should be doing.
And what
but
you're
here we have
seeing.
somebody who told you what. Now you really know what you should be doing.
Yeah.
All right, so
So-
let's all go buy some new hats, buy some sunscreen, and have fun in the sun. We'll see you next time right here on Skin Sense.